I'm Gregory Lip. I'm Professor of Cardiovascular Medicine at the University of Liverpool at the Liverpool Centre for Cardiovascular Science. I'm the co-principal investigator of the ARISTOTELES project. Well, this is a project which I think highlights the opportunity to make a difference in terms of using artificial intelligence to help with risk stratification and decision making in a complex clinical arrhythmia such as atrial fibrillation. Well, I'm a clinician. I look after patients. I look after real patients, not artificial patients, but nonetheless, these are patients with atrial fibrillation who are elderly with multiple risk factors, different comorbidities, the changes in drug therapies. We also have a rhythm that is highly dynamic, and it's an artificial intelligence which tries to integrate all of this into more personalized decision-making, risk stratification, management strategies, and hopefully and ultimately to improve the outcomes in these patients. Well, firstly, patients are not yet in terms of their associated risk. It's not based on a single condition, yes, no. Many conditions coexist with each other, and they don't just stay static at one point, they change because risk is not static, risk is dynamic. Take, for example, a patient with atrial fibrillation and associated diabetes. And with diabetes, again, it's not a diabetes yes versus diabetes no, because the patient with diabetes very likely will have associated vascular disease, renal failure, things like maybe heart failure, and all these are in combinations which are impacting on the outcomes and the management of these patients with atrial fibrillation. Not only is risk being dynamic, we also are dealing with a rhythm, i.e. atrial fibrillation, that is dynamic in nature as well. And that changes over time, and it is progressive. And treatment and adherence to treatment and persistence to treatment, that again doesn't stay static. Changes in a dynamic manner have implications for outcomes as well. In the next 10 years, I hope to see opportunities in improving the care and management of patients with atrial fibrillation. This may well be clinical advances in diagnosis as well as treatment. Nonetheless, the growth of artificial intelligence in healthcare is here to stay. And this will ultimately, I suspect, help to personalize management strategies in the patients with atrial fibrillation who are clinically complex and therefore will require approaches that can be tailored towards improving their diagnosis and management.
That's all right.